steal that box to myself, and when it arrives, I'll smash it.
Oh, go.
Hi, I'm Katie Edwards with Channel 3.14 News, and we interrupt your program for this breaking news broadcast. Several athletes in the Erath County area have been going to the doctor due to an unknown epidemic that is sweeping the Charlton State campus. Doctors in the area are diagnosing this epidemic as knee bursitis, or inflammation of the bursa in the knee joint. Everyone has three major bursa in their knees, and the most commonly inflamed is the prepatellar bursa on the top of the knee. The bursa can become inflamed from direct trauma to the knee and commonly occurs when maintaining a prolonged kneeling position. Bursitis is caused when bursa fills with blood and fluid from injury and overuse, such as from athletic competition. Some of the symptoms are varying degrees of swelling, warmth, tenderness, and redness in the overlying area of the knee. When compared to arthritis, it is only mildly painful. It is frequently associated with increased pain when kneeling and can cause stiffness and pain while walking. Treatment of this injury depends on whether or not it involves an infection. Aseptic prepatellar bursitis can be treated with rest, ice, anti-inflammatory medicine, and pain medication. Occasionally it requires aspiration or draining of the fluid. This procedure involves removal of the fluid with a needle and a syringe under sterile conditions and can be done in the doctor's office. It can also be treated with an injection of cortisone medication into the swollen bursa and can be done at the same time as the aspiration procedure. And that's how the cookie crumbles. You stay classy, Charlton State.